Scene script. Have you ever wondered about the current state of the Canadian healthcare system? Let's dive into the facts and figures that paint a rather vivid picture of the current scenario. According to a recent report by the Canadian Institute for Health Information, or CIHI, hospitalizations due to COVID-19 saw a surge of 19% in the period between 2022 and 2023. Contrarily, emergency department visits related to the pandemic saw a decline during the same period. However, it's not just the pandemic that has put a strain on the healthcare system. Around 12% of Canadians are currently without a family doctor. This lack of accessibility to primary healthcare is a matter of serious concern. Moreover, the waitlists for medical procedures have seen a significant increase, from a median of 19.4 weeks in 2015 to a staggering 31.5 weeks in 2021. That's almost an entire year. The system also witnessed a decrease of 743,000 surgeries during the first 2.5 years of COVID. Another alarming statistic is the 18 million overtime hours worked in public hospitals between 2020 and 2021. That's the equivalent of 9,000 full-time jobs. This immense amount of overtime is leading to healthcare worker burnout, adding another layer of complexity to the challenges faced by the Canadian healthcare system. Clearly, the Canadian healthcare system is facing a multitude of challenges. Now, let's consider the cost of healthcare in Canada. The numbers are quite staggering, to say the least. Canada is home to the second most expensive healthcare system worldwide. This fact alone is enough to make anyone sit up and take notice. But what does this really mean for the average Canadian family? Well, let's break this down a bit. In the year 2023, the average Canadian family, consisting of 2 parents and 1 child, is projected to spend approximately $17,000 on healthcare. That's not a small amount, it's a significant chunk of a family's annual income. This is the reality for many Canadian families, and it's a burden that weighs heavily. The cost of healthcare doesn't stop at the individual or family level either. It's a cost that is borne by the entire society. Every Canadian, whether they realize it or not, is affected by the high cost of healthcare. It's reflected in the taxes we pay, the services we receive, and the state of our public health system as a whole. So, what does this mean for Canadian families? It means that a significant portion of their hard-earned income is being allocated to cover healthcare costs. For some, it may mean having to make difficult decisions and sacrifices in other areas of their lives. For others, it may mean the struggle to afford necessary medical treatments and procedures. In the grand scheme of things, these costs add up and have far-reaching implications. They affect the quality of life for Canadians, the access to timely healthcare services, and the overall health of the population. The financial burden of healthcare in Canada is not a new issue. However, it's an issue that continues to grow in magnitude and complexity. As the cost of healthcare continues to rise, so too does the financial stress on Canadian families. It's clear that the cost of healthcare is a significant burden for Canadian families. The question remains, what can be done to alleviate this burden and ensure that every Canadian has access to affordable, high-quality healthcare? Well, what if the problem isn't just about the amount of money, but how it's being spent? That's a question we need to ask when we look at the current funding model for hospitals in Canada. Let's break it down. In Canada, the prevalent model of funding for hospitals is based on what we call global budgets. Under this system, a fixed amount of money is allocated to a hospital for a specific period, usually a year. This budget is meant to cover all the hospital's services, regardless of the number of patients treated or the complexity of their conditions. Now you might be thinking, that sounds reasonable. But here's the catch. Under the global budget model, each patient essentially represents an expense. And what do you do when you're trying to stick to a budget? You try to cut down on expenses. This means hospitals are incentivized to reduce access and expenditures. For example, a hospital might limit the number of surgeries it performs, not because they're unnecessary, but because each surgery represents a cost that eats into the budget. This can lead to longer wait times for patients and potentially poorer health outcomes. Furthermore, global budgets are notoriously inefficient in containing costs. Without a direct link between funding and patient outcomes, there's little incentive for hospitals to improve efficiency or innovate. Instead, they might opt for cheaper, potentially less effective treatments to stay within budget. This system also puts enormous strain on healthcare workers. With a fixed budget, hospitals are often understaffed, leading to overworked employees, higher burnout rates, and ultimately a decline in the quality of patient care. The current funding model for hospitals in Canada is clearly problematic. It encourages cost-cutting at the expense of patient care and fails to incentivize efficiency or innovation. As we will see in the next scene, there are alternative funding models that could potentially address these issues. But for now, it's clear that a change is needed. So what's the solution? One idea gaining traction is activity-based funding. Now let's delve into the concept of activity-based funding. Imagine a system where each patient is seen not as an expense, but as a source of income. Intriguing, isn't it? This is the essence of activity-based funding. In this model, hospitals are paid based on the number of people they treat and the procedures they perform. It's quite straightforward. The more services you provide, the more funding you receive. This approach is in stark contrast to the current global budget model, where hospitals receive a lump sum to cover all their activities, often leading to inefficiencies and a focus on cost-cutting. But what does activity-based funding mean for healthcare? First and foremost, it incentivizes hospitals to treat more people. It's a simple equation. More patients equals more funding. This could potentially lead to shorter wait times and improved access to services. Secondly, it encourages efficiency. When hospitals are paid for each procedure, they are more likely to streamline their processes to deliver services more effectively. This could lead to cost savings in the long run without compromising on the quality of care. Finally, it promotes transparency. With activity-based funding, it's easier to track where the money is going, as each procedure comes with a specific cost. This could lead to better accountability and governance within the healthcare system. Now, it's worth noting that activity-based funding is not a new concept. Some Canadian hospitals have already adopted this model, and the initial results are promising. However, the majority still operate under global budgets. The transition to activity-based funding requires careful planning and implementation, but the potential benefits make it a compelling option to consider. So, there you have it. Activity-based funding, a model where each patient represents a source of income, could potentially increase access to healthcare and improve cost efficiency. It's a bold step forward, but one that could bring about much-needed change to the Canadian healthcare system. Activity-based funding could be a game-changer for Canadian healthcare. Change to the Canadian healthcare system can only come through innovation. As we've discussed, the Canadian healthcare system is in dire need of an overhaul. We've examined the rising costs, the pitfalls of the current funding model, and the potential benefits of activity-based funding. But the real question is, where do we go from here? It's time we take a step back and look at the larger picture. We need to think systemically, consider the whole rather than just the parts. To truly improve Canadian healthcare, we must embrace and implement innovative strategies. A task force of emergency department physicians in Canada has been doing just that. They've spent 2 years exploring solutions, and their recommendations could be the key to unlocking a healthier future for all Canadians. Their report, available online, is a treasure trove of insights, ideas and strategies that could revolutionize the way we approach healthcare in Canada. They've taken a hard look at the current state of our healthcare system and identified areas in need of improvement. They've analyzed the data, studied the trends, and come up with actionable recommendations that could transform the way we deliver healthcare. But their work is only the beginning. For their recommendations to take effect, they need to be embraced, adopted, and implemented. And that's where we all come in. We need to be open to change, willing to challenge the status quo, and ready to embrace innovative solutions. We need to educate ourselves about the issues at hand and the potential solutions available. We need to engage in the conversation, ask tough questions, and push for meaningful change. So, I encourage you to take the time to read the task force's report. Learn about the challenges we face and the potential solutions they proposed. Become a part of the conversation and help drive the change we so desperately need. After all, the health of our nation is in our hands. We have the power to effect change, to shape the future of Canadian healthcare, to ensure a healthier tomorrow for ourselves and generations to come. It's time for a change in the Canadian healthcare system. Let's explore innovative solutions to make this a reality.